Welcome to LA.
Oh boy! Oh my god.
Ooh. Gotcha.
Like.
Something came out. Came up, right? Boot. Welcome to the office. Well, guess
So
who's
personal.
back? How you doing?
Amazing. I was squatting and then I remember feeling like a super strong pain right here.
It's just there.
Just there. Nothing
Not
else.
here.
No. And
Not up.
No.
Not
just
down.
right here.
Okay.
And then my leg would literally shake. And right now it kind of hurts right here.
So
A little bit.
the front shin is hurting because she's not getting dorsiflexion in the ankle. This is hurting or this is hurting because the mechanics of her pelvis are off. Watch my fingers. This is the tailbone. This is higher, this is lower.
See?
Ready for the action?
Squat, squat.
Watch,
This moves, this doesn't move.
See?
So because this isn't moving, it's throwing the mechanics of the whole foot off. And the first thing we're getting, 10 points, left side, is down low.
Leaves.
Aquí,
See?
aquí. Numero uno.
Sacrum.
Coccyx,
Oh.
S5. Tender. That's the one.
Oh my god, that hurt my back up here.
Yes. See?
Yeah, I see.
Tender.
I see.
You see
it.
that one? More tender there.
Ah, yes.
9.
Oh, that hurts.
That one.
Yeah.
So it's actually the right pelvis like we did last time.
Okay.
We're going to do right, PIIN. We're going to do coccyx to S5. We're going to do T9 and we're going to do the upper cervical, C1. Let's check up top here.
Do you think
Aquí.
Whoa, 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 whoa.
Uno. 2 on the right, 1 on the left. Tender on the right knee,
A little. Oh, no, 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 no.
left knee.
Yes.
Ankles.
Oh my god, that one hurts
Left
so
side.
bad.
So all of this,
Mhm.
Daniela, left ankle, left knee. By the way, it's tender on the back side as the tibia will work on, and we'll work on the femur.
Yeah.
And then let's check valgus varus stress, like pushing in and out. And the gap is on the outside. So we have swelling of the lateral capsule.
God.
We need to work, and we need to work the ankle. So we're gonna do C2 on the right, C1 on the left, nice and easy. Drop it down.
I love that. Wow. Ooh. Ooh. Whoa.
T9.
Ooh. Wow.
Gotcha. Easy, easy. Gotcha.
Love it so much.
I know. But tell me, that was better than the other ones we used to do with
No,
the thumb.
yeah, that was amazing.
Go left side down now, and let's do the pelvis. Let it roll.
Ooh. Ha
That was an ass crack.
That was amazing.
Walk it out.
This is what I wish I could do every morning when I
Walk
wake up.
it out. That's our new walk, runway.
Thank you so much.
Dale.
How do I walk?
Perfect.
Am I transformed?
We'll go
Closer to nature?
You're hilarious. You
Totally.
feel it. Feel it.
Oh! Yes, I feel it.
Yes, you feel it.
I love how you know I feel it.
You feel
but
it.
it's okay.
I'm on your bum here. Right there, PIIN. Poco. That's it. Gotcha.
That's it.
Now the fun part, Mama.
Oh my
You
God.
remember?
Yeah.
Hi. Hi.
Relax.
Yes, I'm so relaxed. There's no
Eight,
way.
5, 4, 3, 2. Come on.
Uy, no. Qué malo.
No, I know.
Ya, mami, ya.
4.
Oh my
Ya va, ya
God.
va.
Hold on to
I
the
can't
top.
even see the
Hold
top.
on.
Just one.
Hold on, please, to the front. Hold on.
Oh my God.
Poco. There you go.
I love it. No. This is like actually
Ya.
torture.
It's all part of kinetic chain.
Thank you so much.
I'll just take them off a little bit there. 4, 3, 2. Wow.
Eso.
I'm just going to set your ankle lightly.
Ajá, claro.
Lightly?
Talus, fibula. Talus, fibula. Calcaneus, navicular.
So astronomical.
Other side, please.
Wow.
Navicular. So we're doing the drop second cuneiform.
Yeah, love it. Oh! Wow, I really needed this.
Now watch this. Here. Slide your body this way. Stay there and do some squats.
Okay. Wow,
It's
it does feel
different.
better.
It's different.
¿Sí?
So when she's squatting,
He's like,
keep
what?
going. So when she's squatting, this is not catching. When she's squatting, this is not rotating. Turn around. Now it's moving. It's moving now. Bueno.
Arrecho.
Open. We're gonna do the EX, but it's the left side that's out.
Yeah, I feel
Open
it.
all the way. Open. That click is the EX compensation side. So we need to slowly apply pressure on the right side. Slowly close. Hold there. Open. Close. Bust. That's it.
I love it. I love it so much. Yeah.
She's glistening now.
Está buscando.
You're glistening.
No, literally.
Yeah. Oh, I haven't even done this yet.
What?
Come here. I'm going in to the masseters and the pterygoids, and I'm holding the back of her neck, and we're just breaking up some adhesions. It's okay. It's not fun.
Quita la mano.
It's not fun, but I'm not going okay.
So amazing. Hold on.
And then watch, come on this side, you can see what I'm doing here. I'm just breaking up adhesions, okay? That's all I'm doing there. 4, 3, 2, amazing. Don't say it was hard today, girl, it was suave.
Yeah.
Everything was smooth today. Squeeze, elbow, relax, down. There you go. Welcome back to the office.
Thank
You're
you.
welcome. Talk about your hip. You were saying something about the hip.
The hips have no discomfort,
Okay.
but it's what I see that troubles me. Whenever I put my feet together, it looks like my left knee is
Behind.
longer. No, the right is behind. I don't know if...
Sorry, this one is behind, yes. Well, let's take a look and see. Let's put the heels, so we're matching his heels. Put your heels on the ground. Gonstead actually talked about this, and this is due to pelvic misalignment.
Okay.
So we're gonna look at this on the X-ray. The other interesting finding, this looks bigger than this.
But this is bigger on the upper part than
Correct,
this.
but this is bigger at the bottom.
Yes.
What's up, dude?
No,
So we look at this muscle and this. Look at my hands. Now let's do the same thing here. He's right.
this is bigger. Vastus lateralis, I think.
Lateralis is bigger, VMO is bigger here. Well, what's the nerve that controls all this stuff? Quads are going to be L2, L3.
Okay.
T12 can go here. Okay,
Okay.
L1. But we're looking at the mid lumbars. If we're talking about specific nerve
Okay.
supply to the muscle.
Okay.
But we're going to go deeper than that, and we're going to talk about the imbalance of all the muscle on that side because of the imbalance of the
In the
pelvis.
pelvis. Okay. I think that my left, surprisingly, has basically my calf. I think has less ability to contract.
So less plantar flexion down or dorsey up?
The motion is the same, I think, but the ability for the muscle to contract, I think the right contracts better than
Okay.
the left.
He's given us the answer already. What's the nerve that controls that? Comes from the sacrum, right? S1, S2.
Okay.
So this is all, we're starting to get some patterns now.
Okay. Is this all connected with the...
It's all connected
Okay,
to your
okay.
sacrum and your pelvis,
Okay.
yes.
Okay.
Okay. We do see a tilted pelvis. I actually see a little bit off on the pubic bone. You see how this is small, this is big. It's due to the alignment. So let's go over the numbers and I can explain it in a lot of detail. We have a rotated sacrum on the left side that's dropped on the right. We have a rotated pelvis, and the listing of your pelvis tells us this was due to some sort of trauma. And then we have a 3 millimeter short leg on the left side.
Okay.
Here's the thing. If I work on your hips, is going to make that more. So whatever happened started in your tailbone. The hips came later.
Later, okay.
Now follow my process. If I adjust your pelvis, it makes it 4, but if we can get this up here, it makes it back to 2. 2 millimeters is coming from here. In your case, we have significant rotation of the pelvis, but I don't see that I want to start there. I want to get it up first. I want to
Okay.
get that tailbone up. Then we can deal with the
Okay.
pelvis.
Okay.
When we look at the tailbone overall is decent. Overall is good.
Okay.
We got a couple of nubs here. I'm pretty sure I'm going to find something here around S3, S4. I'm pretty sure. Once that's done, we'll probably need to go to your L5. L5 is tilting a little bit. 4 is tilting 3, 2 comes back at 1. 1 is level. 12, 11, 10 starts to tilt again. These discs are all fantastic, by the way. Looking at the neck, C2, 3, 4, 5, 6, 7. Like I said, there's something going on that caused this little kink here. And we're going to see if we can change it through some postural habits, okay? Extension, they all go back. Flexion, they go forward. This one didn't move. That's the culprit. 2, 3, 4, 5, 6. Number 7 did it. You see it's still tilting back. It's
Okay.
still stuck there. So we have a C7, we have a T6, and we have your foundation. That's
Okay.
what I see there.
Okay, okay.
Okay? You feel you sway, right, when you walk?
Always.
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 So he walks side to side when he walks, okay.
And my balance is off some of the time.
Yeah, so what's happening in his tailbone, he's not doing this. He's going this way, side to side.
Okay.
And the first thing we're going to get is the base, C6, C7. Then he's got a lot of heat up here too. C1, C6, C7, T6, left side, 5 point. There it is. S3, S4. Open and close your knees, please, with your feet touching. Open and close. Right side only, please. Open and close. When he does the right, the whole left is shifting. Left side only. When he does the left, the whole right is shifting. So it's the sacrum. It's the tailbone.
It hurts more on the left, I think.
Yes. It's more swollen here.
Okay.
Right there. 6, 7, 6, S4. Sit back for me, please. 7 is not moving. 6 is moving. 7 is not moving. C7, PLS. We're hooking right underneath there. Chin back. Open it up. Drop it down. Down. There you go. Home run, baby. Welcome to LA. Come on down. Face down. S4. Torquing. Up. You got him? That's the home run, baby. Part 1, PLS side slip on the transverse process. That's part 1. PLS on the spinous. And bury it in. Look at his dimples. Tell me if you see the difference. So before he was going like this, now he's going up and down like this. Open and close the knees. Right side only, please. Left is fine now. Right, left side, right is fine. So both hips were stuck from the sacrum. Both hips are moving now. Slowly open. Right side comes out first. Keep going. Okay, so we have that right AI. Now, slowly start to close. Good. Open. Slowly start to close. We're going to do a scapular adjustment. Take your hand out of the gown, please. Left hand behind your back. You're going to come over here, down on your knees, please, ma'am. Slide up, sir. Slide up. And you're going to catch like a catcher. One hand here. Like,
Okay.
relax first. Relax there. Catch, don't push.
Okay.
Now, the scapula adjustment is not a true joint. It's a functional joint. There's a bursa that sits inside. And what's going on with him is the subscapular bursa is inflamed. That's why it's not gliding smoothly. What I'm going to do here, relax there, we're going to start to glide it this way. Deep breath in, blow it out fast. And you're going to catch. Relax here, please. Relax the elbow. Deep breath in and out. There you go. Hand forward, please. That's it. And let's check the rib. Right there. Deep breath in. Blow it out fast. Try not to push me. Let it go down. Tummy down. Down, down, down. Gotcha. As you're walking, a few times back and forth, first thing I can see, we can all see it. He got his groove back in his dimples. Yes.
It feels different now. I think I can keep a straight line when I walk.
You're not dragging that right foot as much. Remember, we'll go back to the video. He's dragging both heels. You're not dragging as much now. It's there, but not as much. Walk on your toes should be easier now.
Yes, a lot.
Good. Turn around, walk on your heels should be easier now.
Maybe harder on the right. Maybe.
Pop your clavicle a little bit. Keep going. Keep going.
If you push, it will stop.
Oh, okay. Go on your back. Then I push for you. On your back. SC joint. Just set this. There you go. Good.
Okay.
Okay. Move it back and forth. A little different. That's where we're going to start with you, okay, sir?
Okay.
What's up, Jay?
Hi.
How are you?
I'm happy. I'm
Are you
well.
smiling today?
I am. I'm excited to be here.
This is visit number 3.
Number three.
Tell me.
So definitely there's been like an evolution. I don't feel that heat that I was feeling prior. If I would have to say anything on the pain scale level,
Yeah.
I probably went down to like a 4. So I went like 8, 9, 5, 6.
When you're saying that pain level, you're talking about the hip?
No, I'm just saying like overall the
overall
heat,
overall
kind of
heat.
like the discomfort.
Okay.
Yeah, I have so much more movement now.
Okay. How's the deep pain?
The deep pain, it just feels sore. It just feels really sore and like tender. I feel it in like the back glute area.
You know why I'm smiling?
What?
Because we're going to go deeper.
Yeah,
Okay.
I have a
We
feeling. I know
have to.
today's the day.
We have to. Okay.
One of the things that I've noticed is like when I'm laying on the ground or something, if I were to put my foot against the wall, right? If I was doing my right foot, right, I can easily raise my heel and lift this, right?
Yeah.
But if I try with my left, it's like I can point my toe and it stays there.
That's plantar flexion.
When I'm sending the communication to like, let's put the heel down first, let's feel that strength, it's as if almost all of this, it's like a fake contraction. I don't know how to explain that, but it feels like it's just locked.
You're compensating.
Yeah.
So instead of using the part you need to, you're kind of compensating with the whole body.
And it feels as if it's like seized. It's like, it's almost like, it makes me
What
think of
is
the jaw.
seized? What feels seized?
The communication or whatever, the movement between my heel and my calf muscle. It feels like, you know, you're moving your jaw up and down. So it's almost like the heel is like, it's supposed to glide and move, right? And the calf response
I'm listening.
to that.
I'm just putting the back of your
Right?
seat up.
And it's as if like there's just like some sort of movement that just it got locked and it's not behaving.
Can you raise your whole leg up here, please? You okay with that?
Yeah.
Okay. Can you straighten out the leg?
Okay.
Do you have to force it?
Yeah. I do have to. I feel like
Where
I feel like it's just hanging out like that. Like I feel like that's what this whole movement is. It's just it's hanging out like that.
touching your leg, okay?
Okay.
Okay, point your toes.
Point toes to the wall.
Okay, so when she does that, okay, you're contracting the calf.
Yeah, and it's
Bend
just
the knee a little bit.
there.
Point the toe.
Oh, crap. Crap.
Straighten it out.
Okay.
Okay, relax the toes.
Okay, and now
Relax.
it's just okay.
Relax the toes. Okay,
Okay.
right there.
Uh-huh.
So straight now. Push
Okay.
the toes. Okay, so
I'm gonna
plantar.
push that.
Good. So that's the calf or the gastroc. Bend the knee.
Uh-huh.
Okay. This is soleus.
Okay.
Push. Ah, okay.
Right
So
there.
soleus is
Yeah.
weak. That's
And
different.
it's moving. Yeah, it's
Yes.
like that.
So with the leg straight, it's gastroc, the outer, the heart-shaped calf muscle. Push. Bueno.
Yeah.
Okay. Bend the knee. Push.
Yeah.
Weak. So there's weak soleus muscle on this side. We got to figure out why.
But it got like taken out. It got like KO'd on that in that injury that I had in November.
Okay.
And that's what was so like what happened.
Okay. Straighten it out. Okay. Now bring your toes back.
That feels nice on my calf.
Put it on the chair so I can test something. Okay?
Okay.
Bring your toes back.
Okay.
All right.
If I had a strap, I'd help you out there, but
Bring the toes back. Okay, just hold it.
Okay.
Relax it. Let the toes go down. Point the toe.
point the
Point it,
toe.
point it.
Okay.
Go ahead and bring them back. Point the toe. Point the toe. We're just going to do it quick.
Okay.
Up. Hold on. Right there. Tender.
Yeah. Absolutely.
So when you're doing that, I'm feeling it here.
And
But
I can
when-
feel it when I walk.
But I'm
in
feeling
that
it right
area.
there.
Yeah.
But when I go here, no nada. It's that one. Okay. Ready to keep hunting?
Yeah, I'm ready.
So what am I feeling? 1, 2, 3, 4. That's 4.
S4.
That's 3 S4. Stand up and
Yeah.
walk for us so we have something to compare. Visit number 3, guys.
Right. I feel that when I walk with shoes, it's a lot more supported because my toes, you know, they're strapped into the shoe.
Okay. Have a seat back over there. Yep, S3, S4 now. T910, C1. That's what I'm getting. That ain't moving right there. 4, 5. I'm gonna go down in the coccyx, okay?
Right there, a little bit.
A little bit.
This one I kind of feel on the right.
What's that?
I kind of feel that one on my right knee.
Right coccyx. Dude, it's like I gotta remodel your tailbone, yo.
Damn.
Before I can even get up there.
Damn.
10 or 11?
I think the more 11. Right there. Right there.
Okay.
Whatever that is, yeah.
2, 3, 4, 5. We're gonna start with 5. Drop. There you go. Let's start with that. Okay. Coccyx right.
Ooh.
There.
Oh my god.
Drop the shoulders. There you go. Good. A little bit. There, gotcha. Simon.
Geile Holmes.
What?
Geile. I'm
Geile.
gonna say that. Geile Holmes. Simon.
Simon. You ready to receive?
Yes.
Feet together a little bit. There you go. Gotcha.
feel more warmth in my calf,
But not that heat.
not heat.
Flow?
Flow. Sensation. I can feel it.
Sensation?
Like I feel like it's like right here. I just feel different here. Like flex.
Diferente?
Yeah.
That's the 4.
Yeah.
Now, bring, yep, move that leg.
What do you need? Like moving it?
Yep, just what you're doing.
Just moving
I gotta do that left pelvis too. Let's go to your pelvis.
it. Let's do it.
PIIN, posterior, inferior, internally rotated. And we're referencing that, the listing is referencing the misalignment of the PSIS to the sacrum. I'm on the pelvis, there, right there. So we want to lift this up and out. That means I got to hold this down and out. Okay, so I'm holding the right ASEX. Just lean over a little to the right. There you go. Holding there. Gotcha.
Right, walking in place. Walking in place.
What happened?
Just like feeling my hips, because one of the things that I would notice when I would walk is like I would always feel like my left hip was just
Come on.
different.
Hold over here. Hold the wall. Raise the right first,
Okay.
and then raise the left.
Yeah.
Raise the right.
Right.
Good?
Yeah.
Raise the right. Good. Well, this side definitely doesn't move as well as the right, but it
Yes.
moves better.
Yeah. We're just turning on that power.
Yep. Is that different for you?
Yeah. I wouldn't even be able to lift like this. I would get stuck right here.
So it's moving better, but
Yeah,
it is
maybe getting
we
more.
will deal with the pelvis, and as long as you can handle that combo, it's not a textbook combo to do
Right.
coccyx, sacrum, and pelvis, but that's what you need on the visit.
Yeah.
We got to go with the patient needs.
Thank you.
You're welcome.
All right.
Questions for today?
No. It's
Just
just
taking it
recovery.
one visit
Yeah.
at a time, going through the journey.
Mhm.
Note any, as you do, you're very in tune with what's going on. Any changes, just make a note, and we're taking it one visit at a time.
Will do.
Okay?
All right. Sounds good.
Have a
Thank
week.
you.
Have a
All right.
fantastic week.
All right.
Welcome back.
Thank you.
So you had one visit with me. You came a
Mhm.
few weeks ago, about a month
Yeah.
ago,
Yeah.
and it's for your scoliosis, right?
Mhm.
And we did a whole evaluation.
Mhm.
We went over everything.
Yeah.
Tell us what happened.
There's a lot of changes for the past almost 2 months. First, in my head, I can now tie my hair the whole shift without having migraine. I can't do that before. My neck doesn't hurt anymore.
Okay.
I was shocked. I
With
really didn't expect.
one adjustment.
I didn't expect anything with that adjustment because for having almost 10 chiropractors, I didn't see any changes before. But
So then what did
I
you?
didn't expect
What
that.
then what did you come for? What did you expect with coming up for one visit?
I didn't expect a huge changes. So I was like, oh, I don't have that neck pain anymore. The mid back, there's still pain in the mid back.
Sure.
I'm so shocked. My hips doesn't have no pain anymore. I don't have any pain anymore when I get up or lie down. It's so smooth. I'm still using my binder though at work for the
Please.
past few weeks.
Yes.
And there's a time I forgot to use it. And I'm so anxious. I got so scared because I'm so used to wearing it for years.
You're talking about your brace, right?
Yeah, the binder, the
binder.
Velcro type.
Yes.
I get scared because my body is anticipating pain. It's what I already know in my body.
Her story of pain.
Yeah,
Mhm.
so the whole time I was scared and I feel like pain is coming, but yeah, I didn't feel any pain in my hips. I was like, oh my god.
This is cool.
I was almost so emotional that time. I don't. Oh my gosh.
This is good. This is good. It's okay. It's okay. It was a big deal for you.
It's just so painful. I get to sneeze now without it's smoother. But I still use my binder if I know that I have to carry something. Like my flight going here, I have to use the binder in the airport because I know I
Sure.
have to carry the luggage. Like it's not like carry it, but it's not heavy. But I think it will give me pain. I don't know. I'm still scared.
You still use it,
I-
okay? You
yeah.
still use your binder, you still use it.
Yeah, if I know that I have to carry something,
Right.
because I'm scared. I don't want to be in pain. Because if it's just a physical pain, I can handle it. But it affects my the way I handle things, like my relationship with other people. It's making me cranky. I don't like it.
Pain sucks.
Yeah. It's just not physical pain. It's not.
The
Yeah.
physical part is actually easy to deal with, isn't it?
Yeah.
It's when it starts
Because
affecting your
I'm
psyche
so
and
used to the pain, but
the story of the pain.
yeah.
Yeah.
hmm
Okay.
And then my wrist, it's when I do yoga, it's not that painful anymore, but I can feel some pressure,
Sure.
but no pain. Yeah, that's what I notice the transition in the yoga, like standing up, going down. It's smoother now. My hips doesn't hurt that much.
In her case, you know, we did the evaluation of your scoliosis. And what we found is we found some bones that have changed shape. So this isn't a case where we're going to do adjustments and we're going to straighten out your spine. What are we doing? We're trying to find your balance point. And with what we adjusted that first visit, we adjusted Occiput, Tailbone, and T7, I believe.
Yeah.
And that was enough to get the pressure off the nervous system and give you some quality. And just know this is a management. It's finding a management point for her that gives her quality of life. That's really what this
Yeah.
case is. We started on our tailbone down here. And we'll see, we'll take a look and see. We'll probably do tailbone and push the pelvis up depending on what we find. We're gonna continue on top. You got a tiny bit hiding out right there. That's around T5, sacrum left SI joint, and then bottom right. This one or this one?
Oh yeah, that one.
That one. L5 is
Good.
tender, yes?
Yes. Oh, okay, okay.
S1,
Yes.
S2, S3.
Yeah, that one.
S4, I'm outside, okay, on the bottom. S5, and down in the tailbone. Yes?
Not really, but
Not
it's
as-
tender. Oh, yeah, it is.
On the right.
Okay,
There
okay.
it is. There it is.
Yeah.
It's right coccyx,
Mm.
sacrum. Right
uh.
there. Left occiput, and we're going to do an occiput this way. Down.
Oh boy!
Gotcha.
Whoa!
Gotcha. Head down, please. T5. 1, 2, 3, 4, 5. You see how far out I have to be here. T5. Hand down, please. Gotcha.
And I walk smoothly. I notice it, like my hips doesn't give me pain anymore.
Nice. Let's go left side down, please, over here. I'm down low S5 coccyx. Let it roll.
Oh,
Gotcha.
oh, that's it.
That's it. Let's go to the other side now. You still with me there, eh? There it is.
Okay. Oh.
Gotcha. Stay on your back, please.
Oh.
Talus,
Okay.
fibula,
Oh.
bottom leg, top leg, calcaneus, navicular. Other side, please. Heel, navicular. Sit up and turn, please. Ears.
Oh, wow.
Open. Right EX, left AI. We're gonna do the right EX. Can I go?
Yeah.
Open all the way. Open. Close halfway. Hold. Hold. Don't move. Open. Close half. Hold. Bus. 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 Open. Different.
Aray. No, there's no clicking. Thank you,
God
Doc.
bless you. We're on a journey here. Tell me what's going on.
I want to talk to you about this also. So my headaches, I've been like fighting a headache.
When those headaches are coming, we need to figure out why. So before you talked about cracking and popping your spine, you started to feel headaches from that. Have you done less of that?
Like non-existent. I did it
Okay.
once and I didn't get a headache just because I don't know.
Okay, so we ruled that part out.
Mm-hmm.
So the next thing is, what type of headache is it right now? Top of the head, tension headache, back of the head?
I think tension, but I'll feel it in here kinda.
Where's here? Top?
Like right where
The base of the skull?
yeah, that
Okay.
occiput thing.
Okay. Is the occiput holding? Because I'm working on it quite a bit. We shouldn't have to work on it this much.
Yeah.
Is it holding or not? Straight up,
Most
yes
of
or
the
no?
time.
Most of the time it's holding. So what's
Yeah.
throwing it off?
Probably my posture. Like I sleep on my stomach.
Well, hold on, stop. That's the,
I know.
That's a major answer.
I know.
I need to show you this. No, it's important. So stomach sleepers, why is this important? If you're sleeping on your stomach, this is okay. That I don't mind. But which way do you turn your head?
It depends. Like I'll be like
Majority, left.
probably left, yeah.
Okay, so let's turn to the left. What does it do? It twists the spine. And after 5 years of that, those
Was it
ligaments, yeah.
Oh my god.
Look, if you're straight with the head down, it's fine. Look, if the head is turning, the spine turns all the way down to L1. So after a while, and then we compensate.
Oh, is that why my spine is like,
Look.
oh my god.
So then we get what? We get twisting and compensation.
Oh my
So
god.
this is not going to hold. I'm happy to see you every week if that's what you want. But that's not the fix, and that's not what I'm trying to do.
Well, so here's the thing.
You need to change your sleeping positions.
Yeah.
TMJ. Poppy, cracky,
Yeah. It'll be like
popping.
no, like a
And it wasn't like that before?
I noticed it more now. But I don't know.
Could that be also why the occiput's not holding? Could that be part of the headaches? How about the tailbone? From our last, we changed it up. We did Coccyx and S4.
I think it's been good. I think it's been, I mean, I still feel it, but I think it's been good. I just can't sit on the hard ground, which I don't think you probably should, right?
Correct.
Yeah.
Correct. Okay.
Yeah.
So we have jaw, we have spine we'll deal with, tailbone, the foot.
Yeah. This gone. I mean, it's a little tiny bit. It's
More than
there.
50% better.
Yes, absolutely.
So the main issue today, number one, is the headache
Yes, headache.
with the occiput
Yeah.
and the jaw.
Mhm.
Now, if the occiput's not holding, yes, it's not holding. We're going to check the right atlas and then come to the left occiput. T2 to 5 points, left side. So the sacrum, coccyx, we're still going to deal with, okay? And now what we want to check is what's going on with that atlas. And if that occiput's not holding, we know it's there on the left. Yes?
Yeah.
But we need to go there right now.
Oh. Ooh.
Okay?
Ooh, yeah.
So we have a whole different combo. 7, 1, 4. Sit up straight. 4, 5, 6, 7, 8. 5, S4, coccyx, atlas, occiput, then we'll check TMJ and foot,
Awesome.
shoulders. Okay?
Hell yeah.
You ready?
Yeah.
Let's do this. We're gonna do left side down for the coccyx, S4 on the other side. So let's go here.
Ooh, yeah, that was all there.
Go right side down.
Oh,
A little more.
I'd say so. Oh.
That's it. So if there's more than one, I have homework for you. Your dimples are moving way better, by the way.
Yeah. It's
Yeah.
kind of hurts.
Keep
Maybe that's
walking.
like what I don't know.
Work it out. shifting around. Is that getting easier on the side right now as you're walking?
Yeah. Yeah, definitely actually.
T5.
Oh my god. Oh, I needed that.
Home run.
Oh my god.
Slide up. A little more.
Oh.
A little more.
Oh.
There we go. But the process took a moment.
I needed that.
Occiput.
Oh, I felt that one on my jaw.
That one?
Yeah, I was like, it's like
Can
right
we,
in
Can we
there.
check something? Open. Close. Open slow. Okay. Let's do the occiput. There we go. Gotcha.
Oh my god.
Now that's the home run. Walk it
Yeah.
out.
Oh my, that's like all in here.
How's the head?
It's good.
Right?
Mhm.
That 5 cleared up the rib, by the way.
Like, what was wrong with the rib?
T5 was rotating and it was pushing on the rib. You see, this is the thoracic spine. It has those extra little bumps inside there. Those are called demifacets. But what they are, you see, these don't have it. You see, they start here and the end here. Those don't have it, do they? See those little notches? That's where the ribs sit. So these little notches here, that's where the rib sits. And when the vertebrae rotates, it pushes the rib pushes it out a little bit. And that muscle knot you were feeling was from the rotation of the rib pushing there. And by setting the bone forward, it changed the position of the rib.
Wow.
So this,
I just moved you just moved my rib like that?
I just moved your rib like that. For your good.
It's rough.
That's cool, right? That's that cool stuff. Slowly open. Open all the way. Close halfway. Hold. Good. You got it. You got it. Open all the way. You're good. You're doing much better today. Open. Close. I got you. You got it. You got it. Yeah, that's it. That's it. That wasn't so bad.
Yeah.
On your back, please.
Okay.
Is there, but it's not as bad.
Yeah.
5, 4.
It like
Three.
tickle hurts.
It's good. She's not yelling today.
Yeah.
5, 4, 3, 2, 1. Good.
Oh.
Good.
Oh.
3, 2.
Oh my lord. Woo.
Okay. Let it go. Let's set the ankle. Talus, which is the ankle bone. Heel, fibula. Turn to your side, please. Relax the ankle. Let it go. Other side, please.
Uncomfortable though. Oh.
That's coming off the second.
Oh.
Let it go.
Oh.
Come on, stop fighting me. More on the right, more on the left.
Oh, more on the right.
Alright, posterior tibia. Hold on there, please. Relax there.
Oh.
Relax there. A little more. You good?
Yeah.
There, gotcha. Check it out.
Whoa.
There you go. I had a case like this, and something came to me It didn't show up. I'm going to test it on you. This lady, she came from Fresno. It's a nurse. There were some videos with her. I didn't video this part of it, and her right ankle wasn't releasing. And I found something else in her spine, and we set it and actually released. Just turn on. I'm just curious. Just humor me for a second. Sit. Check it out. This is 5. Okay?
Uh-huh.
This is the one I'm thinking.
Ooh! That one's tough. Ah!
Right? Okay. Bear with me, okay?
Okay.
Let's go on the knee chest tube. Down. Gotcha.
Oh my god.
Yeah, that's it. That's it. I have to, okay? Come up slowly.
Like,
Something came out. Came up, right? Boot.
it felt like coldness. It's really weird.
That's that coldness you're holding in there. L4.
A walk? Okay.
Crazy, right? Did I hurt you? It stung a little
No,
bit, but that what you're right now what you're releasing is not my.
Yeah, that wasn't like really. I mean, yeah, it wasn't really.
It bit a little bit.
Yeah.
It was spicy.
But it wasn't like the whole thing.
But that's not what you're letting out right now, right?
Yeah, I don't think so.
Go on your back.
If this works.
If you gotta let it go though for me. If you're holding, we got a little bit.
Uh-huh.
We got a little bit.
Oh.
That's it.
Oh, it did it?
We got a little bit. I'll
Oh,
take
wow.
it. Walk, check it out now. Tell us.
This is like smoother.
A little different, right? So your homework is you have to change the bed, change the sleeping position, continue your movements, and a new earth.
Thank you.
See you in a couple weeks. Hi, Marie.
Hi.
How are you?
I'm good. What about you?
Nice to meet you.
Nice to meet you too.
Okay, so Marie, you're coming from where?
From Prague, Czech Republic.
You're coming from Czech Republic.
Yeah.
Why are you coming all the way from Czech Republic
Because
to
I-
Los Angeles, California?
To see you.
For what?
Because I have terrible headaches and backaches. But my
Okay.
headaches are way worse.
When did your headache start?
I had a head injury when I was 6 years old.
What kind of head
2000
injury? Just
I
want to
fell
make sure.
from 2 meters
Okay.
onto what.
So for
onto
those
the
2
wooden
meters
floor.
is about 6 feet, right? 2 meters. 1 meter is about 3 feet, so about 6. You fell 6
Yeah,
feet.
I guess, yeah. On
Doing
my
what?
head. I was gymnastics.
Okay.
And I fell on my head.
You fell directly on your head.
Yeah, directly like
On
right
the
here.
mats.
Yeah. No, on the wooden floor. I fell on my like tailbone a few times when I was younger. And then I just have like backaches like right here on my around my like neck area. Besides my headaches, I have like backaches. Sometimes it hurts like down here. Sometimes I just wake up and one side, like next to my spine, it just hurts.
Left side.
Left side.
Okay.
Sometimes right, but it's just like one side of my spine hurts.
And there's something else going on with your spine too, though.
It's like scoliosis, yeah.
So you were told you have scoliosis
Yeah.
as well, right?
Mhm.
And you discovered this when?
About a year and a half ago.
What are you here for? What am I going to do for you? What'd you come for?
My scoliosis and my headaches.
Meaning what? I'm going to fix your scoliosis
I mean, I'm hoping you will.
and I'm going to fix your headaches.
Yeah, I'm
All
hoping
right.
you will.
Okay. Is there anything else I need to know?
Sometimes I'm a little bit like constipated and stuff like that.
Okay.
And like I have reflux, acid reflux as
Well,
well.
then it's definitely related because you're too young to have low stomach acid causing reflux. And are you taking any medication?
I have, but not right now.
You're not on any
No.
medication right now? Okay. So this is the first time that someone had asked me about adjusting with a brace. And this is going to be one of our first cases where we actually have the brace here.
Mhm.
getting adjusted, and we have potential heel lift changes that we may be implementing. And the first thing we want to go over is the overall posture, okay? And we already know from the overall posture, looking at it, that your neck, the lower part of your neck, sits slightly behind your foundation, and then you have what's called a reverse curve in the neck. There is ligament laxity right now. So if we look at the back of the bones here, right, we say there's a disruption. The clinical term is there's a disruption in what's called George's line. But for you, I want you to know, if we draw a line, the back of the body should all connect.
Yeah.
And you can see that it doesn't, right? You can see here. So if we look at the back of this one here, you see how there's a disconnect. That's ligament laxity, and what that tells, we don't need to be touching those. 2, 3, 4, 5, we don't need to be touching because there's already ligament laxity. And if you have ligament laxity and you were on your back getting twisted with your neck, that doesn't help the situation either. Okay,
Yeah, okay.
so no one should be touching her here. Okay,
Okay.
all right. There's a coccyx misalignment. There's definitely this tailbone injury here, S1, S2, S3. So we have S3 potential, we have coccyx, those two for sure. Okay. Now, as we go up the spine, we want to see level parallel discs. And you can see that there's a lot of these circular patterns. That's because of the curvature. These discs are actually all good, but all of this is compensating this curve because we have that what we call the S curve. So the take-home message on the lateral film, we have a coccyx, we have a tailbone injury, we have ligament laxity at 3, 4, and 5, which we don't need to mess with. We have a rotated sacrum 8 millimeters on the left, dropped 5. We have a rotated pelvis. And on this x-ray, without any intervention, without a brace or heel lift, you have a 6 millimeter measured difference. Okay? 5 millimeters of it is coming from your tailbone. So if we can get that tailbone up, then we can help with that imbalance. And then see what the body does. We're going here. We have a rotated sacrum on the left, drop down 5. We have a rotated pelvis. It's gone up and in, and then the whole thing goes down. That's the imbalance. The first thing I do see is there is spina bifida at S1. And spina bifida, I'm not talking about people are gonna Google it and see these really intense, severe cases. What I'm saying is it's failure of the union of S1 or the laminas to form, and it's also a little bit higher. But S1, see, when during embryological development, these lamina form together to form these bumps in our back.
Yeah.
Okay, S1 failed to form, so it's open a little bit. And when I palpate you and touch it, it's going to be tender, but it's not the cause of anything.
Yeah, okay.
And after I've done my job, or after I've adjusted and I touch it, it's going to feel better. We know that L5 is tilted on the right side. It's up on the right. It's causing that wedge. You see that?
Yeah.
L1, L2 there's a lot of rotation there. 12 rotates. Then it starts to balance out. You see that?
Yeah.
You see how that one is smaller, that one is bigger? But then they even out here. And then they switch sides. Smaller, bigger, smaller, bigger, smaller, bigger.
Yeah.
Evens out. This is all compensation. Mama wants you to wear a back brace. And you don't want to wear a back brace.
Yeah.
Why do you not want to wear a back brace?
Because it really hurts.
And how long do you have to wear this brace for, you were told?
Like until I stop
Up
going. I
to
guess.
16 hours a day for several months.
Okay, so here's the x-ray with your brace. The x-ray with her brace does a couple of things. It changes. So what the brace does, see, at a 6 millimeter MD, it created more imbalance in her hips. However, it corrected and changed the rotation of her foundation. But obviously you're putting this thing on and turning it and strapping it down. It's going to change it. Okay? But the more important thing is by doing that, okay, this is what's interesting. And this is why I don't know if I'm a big fan of this brace for your case. And here's why. You put the brace on, that's what all that is, guys. It it helped the rotation. You see P8 became P1. AS4IN3 became AS1EX1. But 6MD became 8MD. So if the hip is worse, things are not going to hold. The brace is going to help you adapt to your problem. So it may change cosmetically what's going on, but it's going to force the innate intelligence in the body is going to fight it. It's going to fight your innate intelligence of what's natural for her. And everyone is an individual, so you can't say, maybe there does need to be a tiny bit of imbalance in your case. I don't know yet, but I'm saying is we don't know. And to try to straighten out her spine may create more imbalance in her pelvis, which will give her other issues down the road. So when I saw that, I said, you know what? Let's put a heel lift. We put in the 3mm first. And what the 3mm lift did is what? It reduced a little bit, didn't it? But it didn't change. It's still 6MD. So this is with nothing. And this is, it's different, right?
Yeah, it looks way better with the
different.
5mm one.
P8 became P4. AS4IN3 became AS3. 5mm MD. I think what will happen is we'll adjust you and then figure it out from there. Looking at her from the outside doesn't actually look so bad in terms of, you don't really see a lot of curvature, do you? There is quite a bit of swelling here in her tailbone and her sacrum. We know that. This hikes up a little bit. But if we look at the shoulder heights, she's compensated very well there. There is a little dishing here, but again, doesn't look so bad. So a little stiff in her movement through her SI joints. So what's interesting, she has the short leg on the left, and you can see the hiking, but there's not a lot of movement in that right above the right SI joint. Keep walking, please.
Okay.
Now you can see she got no movement in that sacrum SI joint. And this is the brace we were talking about, right? This is the typical brace. And you've had this brace for how long?
From the 22nd of January 2024.
Got it, okay. And the first thing we're getting is C6, left side. I know we got this occiput. And you said it was the right side, right? Right temporal lobe.
Yeah.
And we're getting a right occiput. T6, left side. The key is down in the coccyx. S3, coccyx, T6, C6, right occiput. As we're looking at the inflammation and swelling, you can see it starts there. And you start to get a lot of that edema. You see that?
Yeah, it's really uncomfortable.
All that. So you get all that edema there and swelling. Starts at 7 or 6.
Ow.
That's her style.
Ow.
Open and close your knees, please. Open and close. Open wide and close. Good. Keep going. Not so much. Open and close. Right there. Open and close. Keep going. Now, right side only. So when she does the right, the whole left wants to shift. Fixate it. Keep going. Good. Do the left side only. They're both stuck. S1. Ow. S2.
Ow.
Ow. S3. Ow. S4.
That's not that bad.
Not bad. S5.
Not that bad.
I'm going to be on the outside now, down at the...
That's not that bad. Okay, ow.
That's the coccyx.
Yeah.
So coccyx, more at 2,
Ow.
more at 3. Starts at 3. You want to go on the front for a second?
That put the pain down my leg like it was
That
shooting.
caused the shooting pain,
yeah,
right?
Yeah.
Okay.
Ow.
6, 5.
Ow. Ow.
Dude, you're too young to be having all this pain, you. 1.
Ow.
Now let's check the occiput. That's the left side.
Ow.
That's the
Ow.
which one hurts more when I do that?
I feel like the left side. Ow, ow, ow. Yeah, the left side definitely.
We're starting with foundation. We're going to do coccyx S3. I'm going to have you walk, and then I'm going to recheck everything.
Okay.
And then we'll decide what to do from there.
Ow.
There.
Ow.
We're going to bring it up. Good.
Ow.
That's the home run. Gotcha.
Oh my goodness.
Come on, you got to get the smile now. That was good, right?
Yeah, that was
Okay,
really
stand
good.
up.
That
Let's
was
stand up and
really
walk. Let's see what's different. Walk it off.
Whoa, that
What's different?
It feels like more free. Like I can just like walk and it doesn't like it's not that stiff. I don't know. I don't really know how to explain it. It just feels
Keep
way
walking,
better.
keep walking, keep walking.
It just feels way better. Like free. I just
She's
feel like I'm
smiling.
free. I am.
Turn around. Her dimples are moving now.
It
Pretty
feels
cool.
so free.
Now she's moving her dimples. And that was all the coccyx. That was that tailbone injury. Can you feel what this feels like, please? Check it out.
Oh, this is way better.
Different?
Way different.
Okay, now let's go over here up top. L5, do you remember?
Oh yeah.
I didn't touch it. S1, that's the spina bifida.
Mhm.
Different.
Whoa.
2.
That's crazy.
Is that
I don't
different?
feel anything.
Is
Like,
that different?
It's way different. It's not different. It's like beyond different.
Thank you so much.
Yeah, thank you. That's crazy.
And we're just doing a tiny bit of the S3, okay? Chin up. Look up a little. Good.
Ooh. Whoa.
Come back over here, have a seat. And now let's work on the occiput. We're going to go lightly on the atlas on the right and then set the occiput. This one is light, okay?
Ooh.
PS. LS. Good?
Mhm. Ooh. Ooh.
Breathe. Breathe. That's the home run. Deep breathing.
I feel it in my head, like right here. It just like went up, kind of. I don't know how to say. Ooh.
Just breathe. Deep breathing, please. Deep breathing. It's going to be very, very different.
It is. It's like we're free. I just feel like a butterfly. Like I just feel like free.
Mariposa!
Yeah.
Keep walking, please.
I'm walking.
Keep walking. Her foot is changing too already. The swelling is already coming down. Wow.
That's crazy.
Walk on your toes now. Should be a lot easier.
It is.
Yes,
It's like
ma'am.
we're free.
Turn around, walk on your heels. Should be easier.
Oh yeah.
Mhm.
What?
Mhm.
That's crazy.
Have a seat.
Yeah, that's way better.
That's your spina bifida, yo.
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 Yo. Pain?
No, not really. Not. I mean. Like,
Tender, right? From my finger.
Yeah. But there's like no pain.
Okay, that's where we're gonna start. Let me do the work. Over. There you go. Over. There you
How
go.
do you do that?
AS talus medial tilt.
Oh.
Walk it out.
How do you do that?
Voila!
Whoa.
The Gonstead magic.
Ooh. 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 That's crazy.
Okay.
Whoa.
We're all set for today. Questions for today?
I don't have a question. I just want to say thank you because I feel free now. I feel like,
Welcome to
High
the
five.
office.
thank you.
You're welcome.
Thank you.
That's so amazing. Thank you. Wow.
So happy.